So I'll just let them know that there are physicians that take care of this kind of problem. I've run into ladies at the gym that complain of, leaking when they're exercising. So I'll just quietly let them know that there's somebody that can see them for this concern.
Yeah.
Now, if they come into the office, like I say, let's talk. What are your worries? What are your concerns? Let me just listen first and just be very non-judgmental. I mean, this is this is a place to feel safe with what your concerns are and
Welcome to LifeSculpt by ChristiMD, the podcast where we delve into the art of living your best life. I'm your host, Dr. Christi, a board-certified surgeon, wellness enthusiast, author of the BioVitality Blueprint, and your guide to transforming health and happiness. Here we explore cutting-edge health trends, chat with inspiring guests, and share practical tips to sculpt the life you've always dreamed of. So grab your headphones, get comfortable, and let's dive into today's episode. Today, I am extremely happy to introduce you to my new partner, Dr. Nina Dereska. She is a board-certified urogynecologist, and she has been in practice for a few years, and we are just so excited to have her on board. Welcome, Nina. We're so glad to have you. So we're going to talk today. I'm going to introduce you to Dr. Nina and Dr. Dereska, and she is fellowship trained.
Mm-hmm.
Where did you do your fellowship?
I was at Mayo Clinic in the Scottsdale, Arizona.
That's amazing.
Beautiful area as well.
Amazing. So let's start with your story.
Sure.
What inspired you to go into urogynecology and women's pelvic health?
So probably started in med school. So I have one physician in the family who's a gastroenterologist. And he said early on, your only decision early on in medicine is, are you a medicine doctor? Somebody like a pediatrician, an internist that stays in the office, or are you a surgeon?
Yeah.
So that was pretty obvious from the beginning. So we went the surgery route. And then once I got into my rotations and, OBGYN and surgery and everything, the OBGYN just appealed to me beyond anything else, just female patients.
Yeah.
So from there, got into my OBGYN residency. We had a wonderful team of gynecologic oncologists. So I thought I was going to be a gynecologic oncologist for many years.
This is so similar to my path. I decided surgery, and then I had a great group of gynecs. It's crazy. Okay, forgive me.
Well, and I think it really wasn't until my final year of residency. And then I went away and did an away rotation at Mayo Clinic and did my urogyne. I thought, well, that's probably more fitting for my long-term goals.
Yes. Well, we are so glad that you made that your long-term goal, because she's really good at it. She's amazing. Her reputation is just incredible in Houston. You've practiced in both academic and private settings and trained at the Mayo Clinic, which is amazing. What have been some of the biggest lessons you've learned about caring for women over your career?
Gosh, so many patients are different. They come in with just different goals, different stories, different concerns. Some patients just want to come in and just, is there anything wrong? Am I really, are my concerns really valid? And other patients come in with just, I want to have surgery. I want to fix this. So you kind of have to meet them where they're at. Of course, different education levels, different cultural, differences. It just, you have to just kind of be very accepting and just open to, what they're coming in with. Where do they start? I just listen. No.
I love that. Just listen.
I just listen.
Yeah. And having worked with you just this week and watching you interact with patients, you do have a really wonderful way that you talk to them and listen to them and connect with them. I noticed that right away. For listeners who may not be familiar, what exactly does a urogynecologist do? And how is that different from a regular gynecologist or a urologist?
Right. So we do residencies. And so there's OBGYN residency, which is 4 years, or there's a urology residency that's 5 years. To be a urogynecologist, you need to do additional fellowship training. So for an OBGYN, we do 3 extra years, so a total of 7. If you're a urologist that goes into urogynecology, you do two years. So regardless, you end up with 7 years of training. And it's all think about urogynecologist, the pelvis. We do everything in the pelvis, short of cancer. So if you are feeling, pressure, if there's organs that are falling out, your uterus is falling down, your cervix is falling, your bladder, your cervix.
Yeah.
So prolapse is one of the biggest things that we do. But also think about the bladder and the bowels. There's a lot of incontinence issues and bladder control issues. So urogynecology, I would say probably first and foremost is prolapse and bladder control problems, but there's some more unique things that we see as well. So.
Excellent. You've seen so many women struggling with pelvic floor and bladder issues. You kind of touched on this, what are some of the most common problems you treat and what should women look out for?
Perfect. So I would start with prolapse. And essentially prolapse is where your female organs prolapse into the vaginal canal and can even come out of the vaginal canal. They can get that significant. So though prolapse is caused by really a wide variety of things. Vaginal deliveries is probably the most common reason. As we age and go through menopause, our collagen changes, our estrogen levels change. So I usually see some development of prolapse in menopause. Think about lifestyle too. Coughing with asthma, repetitive lifting, if that's something that you do at work. So lots of factors. And then there's genetics too. I can't tell you how many patients come in and say, I've got this bulge.
Yeah.
My mom had a bulge. She had a bladder surgery. So the genetics factor into that as well. So prolapse would be number one condition that I see. Definitely as you can imagine, okay, if something's falling into the vagina, what are you going to feel? It's going to be pressure. A lot of my patients tell me it feels like a tampon stuck.
Yes.
And wants to fall out. Or you may just feel down there one day and go, oh my gosh, there is something coming out.
Yeah. Right. Yeah. Yeah. In the shower, cleaning. Oh my gosh, what is it? And some women will think that they're worried that they have cancer. And so we reassure them, it's not cancer.
Yes. Just a bulging bladder
Yes.
or uterus or, so.
Yeah.
So I would say that's probably my number one condition that I see, but then bladder issues. So, we see stress incontinence, which is, leaking with coughing and sneezing and laughing. So very common. Also, a childbirth, it can be a result of childbirth. Overactive bladder, where you just feel that sudden, oh my God, I've got to go to the bathroom so bad. I've got to, disrupt what I'm doing and run to the restroom. So that's the second. So anything that you feel like is changing with your bladder, are you going more often? Are you going more urgently? Are you starting to wear pads? Those are things that would be signs that maybe it's time to talk.
Would you recommend patients, potential patients who are just having a little bit of leakage to go ahead and come on in and get checked?
I do.
Yeah.
There are circumstances where we may just say, hey, let's just focus on some pelvic floor exercises or get involved with physical therapy, or maybe we offer a chair here that essentially strengthens your pelvic floor muscles. It may be something as simple as that. But then, just to keep it from getting worse. I mean, that's where I'd like to see somebody in the early stages of leakage before it gets worse, where we have to do. But there's some absolutely amazing surgical procedures or outpatient surgical procedures that recovery is minimal.
Yeah. I think it's good to come in early.
For sure.
Then we have more options.
For sure, more options.
And it doesn't, it tends to snowball and compound as if it's not addressed.
Yeah.
I think a lot of women quietly put up with symptoms like leaking or pressure because they feel like embarrassed or it's just a part of aging. So how do you help women open up about these issues and understand that there are solutions?
Sometimes I find somebody out in public that has it that doesn't even come to my office, and they're discussing something that they with a friend in the grocery store or something. So I'll just let them know that there are physicians that take care of this kind of problem. I've run into ladies at the gym that complain of leaking when they're exercising. So I'll just quietly let them know that there's somebody that can see them for this concern.
Yeah.
Now, if they come into the office, like I say, let's talk. What are your worries? What are your concerns? Let me just listen first and just be very non-judgmental. I mean, this is this is a place to feel safe with what your concerns are, and tell me anything.
Yeah.
Yep, truly.
Yeah. Yeah.
Tell me
Definitely.
anything.
Yes.
So,
Yes. And I think a lot of women too are scared that it's going to hurt, or that the solution is
right.
going to cause more problems down the line. And I think we have such great options
Yep.
for patients now that's very minimal discomfort and recovery is pretty quick. So
Absolutely.
we live in a great time.
Yeah.
I know you stayed on the cutting edge of women's health for years. What are some of the newest or most exciting treatments that you're intrigued with, or surgical advances that you're bringing to LifeSculpt?
Gotcha. Well, my love is the DaVinci robot, which I've been,
Same.
oh my gosh,
So
I'm
much
using
fun.
for years. So DaVinci robot, if you've never seen what this is, we do laparoscopic surgery, little minimally invasive incisions, and we place a camera inside the abdomen, and we can do major surgeries with little tiny incisions. And so what the robot does is, when I put the instruments in and I tell it externally to move like this, my instrument internally moves like that. So very precise. The visualization of surgery, what I can do, which I used to have to do 15 years ago with a big incision. It's just fantastic. So
it's a game changer for sure.
Total game changer. So that's my love. But I would say the two newer things, which I also love, would be for stress incontinence. So the leakage, again, with coughing, laughing, sneezing. One is the Bulkamid injection. So some women have stress incontinence because the urethra it doesn't want to close. It's just a little weak. And so we need to apply a little bit of material around the urethra just to help the seal, help it stay closed. So that's an outpatient procedure that takes not even 5 minutes. No recovery whatsoever. So that's the newest, it's called a bulking agent. That's the newest bulking agent on the market.
We've been doing them for a long time. There have been different products, and there's I know you like the macroplastique too, which is another option for patients.
Yeah,
that works really well. We've done collagen. That one would kind of fade away.
Yeah, that one would fade.
Durasphere, Coaptite, they were a little bit too sticky or hard to deal with, and but now I think we've got some really good third generation options that I think the patients are really happy with it.
Absolutely.
Yeah,
absolutely.
That's easy and no downtime, which is great.
I know, no downtime. The last one I can think of is slings. So slings are also for stress incontinence.
Yeah,
and they have been modified so significantly over the years. And now I specifically use something called an Altus sling, which is a very minimal piece of plastic material, essentially, that goes under the urethra, and I can adjust it during surgery. So someone can have pretty severe leakage, and I can adjust it tight enough. You don't want to over tighten, but just tight enough to
that's
fix the
cool.
leak. So that's one of my other favorites.
I love it. I love it. That's awesome. At LifeSculpt, we are passionate about helping women look, feel, and function their best inside and out. So how do you see pelvic health fitting into that whole body approach to wellness and longevity?
Sure. Well, I think as women, we've always our female organs kind of rule our life sometimes, don't they? As
so true. That's a great point. Yeah.
Well, and I think about my daughter when she was young and had terribly painful periods and irregular periods. So we have gynecologists at young ages, and our pelvis kind of controls us for a while until we can get the symptoms under control. So many more things can happen though after after our menstrual cycles stop and after we go through menopause. So many changes. So just keeping your pelvic floor healthy, whether it be, I'm going to do exercises every day. I'm going to do my Kegel exercises every day. Addressing the bladder leakage, because who wants to have an embarrassing accident when they're out? Let's think about some of the intimacy issues that come with the aging, genital area. As long as we can address these conditions, though, it really, we feel normal, don't we?
Yeah.
It's like when we could control our periods, or as young women. So
yeah, you've said before that when you restore a woman's pelvic health, it changes her life, not just physically but emotionally. Can you share an example of a patient that you may have seen that was the case for her?
It is. So I could make the story very long, but because it was over many years that I knew this patient, but I'll I'll abbreviate.
Okay.
So she was in her 60s when she first came to see me with her husband. She had some pressure, some vaginal pressure, those prolapse symptoms. Her prolapse wasn't too bad at the time. She was so fearful and anxious about surgery. So she just put it off. And she had a moderate prolapse when I saw her the first time. So a couple years later, she comes back with her husband again. And I could tell a distinct difference in the way they communicated with each other. They were angry with each other. They didn't look at each other. She barely looked at me.
You could cut the tension with the knife.
It was it was, had I not met them before, I thought, well, maybe this is normal, but I knew it wasn't. Not loving, not he seemed, he was kind of scared about what was going on, to be honest. So what had happened in those couple of years is her prolapse had gotten worse to the point where she actually could see her uterus and feel her uterus outside the body. Uncomfortable to sit, uncomfortable to void. Sex life had stopped. So I think all of that played into their relationship. I mean, it was hard to see them not getting along. So the good news is she finally decided to have surgery and just did amazing. Even with advanced prolapse, she just did amazing. She was probably at this point in her early 70s. And her goal was, of course, to resume intimacy with her husband. And the most recent that I've seen her, she's about 3 years from surgery and totally different person. Like they come in holding hands, kissing, her whole just, the eye contact is back, like everything just, she's her again.
Yeah.
Everything's, yeah.
Oh,
It was something. I mean,
so
I
powerful.
saw the something's kind of wrong, something's really wrong, and then just normal again.
And just think how the trajectory of her life changed. She had this stressful, tense relationship, this physical problem that's bothering her and stressing her. And then now she's lightened up, and she's got that connection back with her husband. So she's going to live healthier longer. I love that so much. That's why we do what we do. Love that. You've walked with women through so many stages, from post-baby recovery to menopause and beyond. What do you love most about working with women through those transitions?
Maybe sharing my own transition, honestly, because I went through menopause at 43, so I was pretty young. I'm 54 now. So 10 years of menopause, I can get lots of advice.
Yes. Same.
But no, I think it's so neat to see what, again, kind of back to that when we were young women, what was our thinking? Oh my gosh, my periods hurt, I can't control my periods. And then it goes into, oh, wow, I'm starting to have perimenopausal symptoms. I'm not sleeping well. I'm having a little bit of vaginal dryness. And so we need to explain what's going on and what to expect when menopause happens. And then all the things that we have to manage after menopause.
Yes.
So it's just, it's just neat. It's neat to have, I've been in Houston for 14 years. So it's neat to have patients I have one patient that was single and now is married with 4 children. And I still see her. I mean, what a transition. But I love the menopausal transition the most.
Yeah.
I mean, that's where I can help and give you personal advice.
Yes. I love it. Okay. And outside of medicine, what gives you joy or keeps you balanced?
So many things, but first and foremost, exercise.
Yes.
Oh my gosh. I don't remember a time where I didn't exercise. I was a competitive swimmer. I was a triathlete. But I'll tell you what's changed my menopause symptoms and physique is bodybuilding, is resistance exercise. I mean, it was a game changer when I was maybe 47, 48. I started to do resistance exercise.
I saw your transformation. Yeah. When I saw you at that meeting, and I hadn't seen you for a few years. So I was like, wow.
It was profound. Because sometimes you don't know you're going into menopause. You're not.
Right.
In my case, I had an IUD. I didn't know I wasn't menstruating. But the weight gain and the sleepless nights and the hot flashes, you finally figure it out. And it's hard to reverse. I mean, it takes some time to reverse those. So, but the resistance training has been huge.
Yeah.
I mean, I still do, my cardio here and there, but that's what changed.
Yeah. So important.
Game changer.
I always say muscle is the number one anti-aging organ. It's so important to keep our muscle built up, and it starts to just decline naturally after age of 50. So you have to work harder to keep your muscle. So,
So true.
and it's just critical.
Yep.
Finally, if you could give one message to every woman listening who might be struggling silently with pelvic or bladder issues, what would you tell her?
I'm all ears. No, come in and just talk to us, have a conversation with us. Maybe nothing is wrong, but then maybe we do need to work on some things.
Yeah.
Come in and I will just sit there and listen.
That's perfect. That's perfect. Yes. We do this willingly.
Yes.
We love what we do. We are both passionate about what we do and helping women and surgery. And so we stand ready. And Dr. Dereska has lots of availability in our calendar, although she is getting really full really quick. She has a big following. So, well, beautifully said, Dr. Dereska. We're so thrilled to have you as part of the LifeSculpt family. We're so glad you're here.
Yes.
For anyone listening who wants to meet Dr. Dereska, you can schedule a visit through our website at LifeSculptMD.com or call our office. She's now seeing patients in our West Houston location, and she's ready to help you feel whole, confident, and strong again. Thank you so much for joining us today, and welcome again to LifeSculpt, Dr. Dereska. Thank you for tuning in to this episode of LifeSculpt by ChristiMD. I hope you found our conversation as inspiring and enlightening as I did. If you enjoyed today's episode, please be sure to subscribe, rate, and leave a review on your favorite podcast platform. Your feedback helps us reach more listeners and spread the message of living a life sculpted by health and happiness. Don't forget to follow us on social media at LifeSculpt by ChristiMD for more updates, behind-the-scenes content, and to join our amazing community. And follow my personal account at Love Life Medicine for more great health and inspirational content. Do you have a Instagram that for patients to follow yet?
Not yet.
Okay, stay tuned. We'll get that going.
Yeah, stay tuned.
Okay. Until next time, remember to prioritize your well-being and keep sculpting the life you love. And remember, most of all, to get to know God, He truly wants you to know Him, to thrive, and to have inner peace. Have a great day.